What is the role of infection in the mechanism of preterm birth?
Okay, so infection is a well-recognized cause of preterm birth. It's particularly a well-recognized cause of relatively early preterm birth, say between 24 and 34 weeks. It's less likely to be a cause of later preterm births. If you have infection and inflammation, that's a significant risk factor for bad outcomes for the babies following preterm birth. Infection could reach the uterus from the bloodstream or from being introduced by the doctor, amniocentesis, but probably the great majority of infection, inflammation associated preterm birth is due to bacteria ascending from the vagina through the cervix and into the uterus.
What is the role of different lactobacillus in the preterm birth?
So we are finding in European populations that one particular lactobacillus, which is called Lactobacillus crispatus, is protective against preterm birth, and it probably works by growing in the vagina and competing out all of the other organisms that can grow there. It produces lactic acid, so it creates an environment that's hostile to other organisms, and it also produces antimicrobial substances, which mean that other organisms are actually specifically targeted. On the other hand, in our populations, a different lactobacillus, which is called Lactobacillus iners, appears to be a risk factor for preterm birth. This is a lactobacillus which doesn't usually produce lactic acid and is not so good at producing those antimicrobial factors. Now, that's not to say that every patient with Lactobacillus iners will deliver preterm. The great majority of them will not, but it seems to be a risk factor. And the idea is that if we could perhaps identify those people and replace the Lactobacillus iners with the good guy, the Lactobacillus crispatus, we might reduce the risk of preterm birth.
Do we have tests for the profile of vaginal microbioma, and could these tests help to prevent preterm birth?
Present time, the way in which we are interrogating the vaginal microbiota involves sequencing the DNA of the bacteria, and that is something which takes quite a while to do. You couldn't use it as an immediate clinical test. It takes weeks and perhaps sometimes months to get the data. But there are ways in which you might be able to identify which bacteria are present within the vagina. Rapid PCR-based approaches are one possibility. And then some colleagues of mine at Imperial College are working on a mass spectroscopy-based approach, which would enable us to determine which bacteria are present very, very quickly using a machine that could be designed to be by the bedside.